Hair transplant in 20s versus 40s. What's the difference? Most of the people think that hair transplant is hair transplant and it can be done at any stage of life. Technically, yes, but to know the differences, please see this video to the entire length and subscribe to our channel of AK Clinics to see such informative videos more and more. Now, what is hair transplant? Hair transplant is basically redistribution of hair from the safe donor area to an area which is bald. So basically we are not transplanting any new hair, but we are just redistributing the hair from the permanent safe area, either from the scalp or the beard or chest, and transplanting into the bald area. So planning is very important and critical while doing the surgery of a hair transplant. Now, what is the dynamics of hair loss? Now, the dynamics is that with every growing decade of life, you lose around 10% of hair. Like 20% of the males are bald in their 20s, 30% in 30s, and 40% in 40s, and by 50s, 50% of the people are bald to a certain level. So this is as per the studies. So there's a history or there's a probability that you will keep on losing more and more hair if you are susceptible to that. And the main causes of this being the genetics or the nutritional part or your thyroid problems or any other hormonal issues which can cause this hair loss. So the first line of management for any patient, whether you are in 20s and 30s, should always be medical treatment. You should take the medicine, that is the finasteride, minoxidil, unless until you have certain side effects to that, and try to stabilize the hair loss. And if the hair loss gets stabilized, that is the best time to undergo a hair transplant. Now when you are in 20s and your hair loss has stabilized, the general age that we take into consideration is 23, 24 or 25, unless the patient has a lot of hair loss. So if you are in that age group, let that hair loss stabilize and then only undergo a hair transplant. Now, why do we say that? We say that because we are more sure about the planning of grafts. Like today you are, just grade 3 bald or grade 2 bald, and you place, I've seen some surgeons placing 2000 grafts or 3000 grafts only in the frontal area. Whereas you have to keep into mind that the safe donor area hardly has 4000 to 5000 grafts. So if you do place 2000 or 3000 grafts only in a grade 2 bald patient or 4000 grafts in a grade 3 patient to do more grafting and give an even more dense look, what happens is when you will become from grade 3 to grade 5, you will be hardly able to have any grafts left behind to be transplanted in the recipient area. So it is more to do about the planning part. You should be as much conservative as possible so that the plan can be made for a lifetime rather than this point of time. Another point is this also stems from the fact that the patient's expectation is very high. They want a very high density. So they try to ask the doctor to place as many grafts as possible in the bald area. Now, when you mature, when you are in your 40s, you have baldness, the patient's expectations slightly decrease. He is ready for a more conservative pattern of hair transplantation or the designing part, thereby decreasing his requirement of grafts in the same area because he is more comfortable to get the hairline in the slightly back side. So, the advantage in 40s mainly is your hair loss would have stabilized, the pattern, you know that how many grafts you have lost and how much can you lose over a period of time. Therefore, the planning part becomes more easier for the surgeon as well as the patient. So it's not that you cannot undergo a transplant in 20s, but it is always better to let it stabilize. Let us see the whole paradigm of hair loss and how many grafts will be required for a lifetime, which will help us to make you look having hair all over your scalp. So this is what I always request the patients to be as conservative as possible and plan your whole life journey rather than just looking in the short term about it. Thank you.